Kathy, what is a yellow zone and what does it mean as you confront a new virus?
Well, thank you for having me back on the show. And yes, I'm embedded in that yellow zone right now. Yellow means caution. And it says that if our numbers don't start trending downward, reversing where we've been for the last 2 weeks, we'll be in a situation where we head into orange and red, and those mean we will have shutdowns. And we'll be trying very hard not to get to a situation where we have to reverse the progress we've made on reopening. But our schools also have to do more testing. We've limited the number of people at gatherings. So it's not the worst case scenario, but it's a warning to our residents here, as I've been saying for days now. Change your behavior or you'll be locked out of your favorite restaurant and you have no chance of going to a football game in person this year and a lot of other consequences. So it's basically trying to say beware and change your behavior starting today.
Lieutenant Governor, the conceit is the big cities have ample medicine, ample hospitalization. I think of Strong and that complex in Rochester. Over in Buffalo, you've seen a positivity rate that has just exploded. Are you concerned with Governor Cuomo about the hospitalization facilities available?
The good news is that we are prepared for even more capacity, far more capacity in the early months of this pandemic, and the governor made sure that we had ample supplies of PPE in all the hospitals. Each one was required to have at least a 3-month additional supply. I've been in regular touch with our leadership of the hospitals. Yes, our numbers have gone up, but it's about maybe 90, 100 people in hospitals in Western New York. We can handle that now, but you're absolutely right. It's something that if the numbers, the number of people testing positive, if they turn into serious cases and hospitalizations required, we're going to have to get back to eliminating the elective surgeries and a lot of the unessential procedures that are now going on. So we can create the capacity very quickly, though. We actually have, unfortunately, a lot of experience dealing with this, and we'll be able to handle it.
In the meantime, Kathy, yesterday we got incredible news on the vaccine front from Pfizer. A lot of people expecting a turn, perhaps an end to the pandemic next year, but there's a lot of daylight between now and then, and some people saying that will reduce the emphasis on a fiscal support plan from Washington, D.C. From your vantage point, how much does this take pressure off of Washington to help with the $12 billion bailout for the MTA, to help with the unemployment as more people get laid off as the virus counts go up, and just help financially going forward?
I don't think they're related. I don't think that having a vaccine takes the pressure off at all because we've already lost that money. We've already lost the revenues and the fees generated from people using our transportation systems or from the sales tax revenues that were not collected, and the extraordinary costs that we had to incur just fighting this pandemic and are still paying for now. That's not gone away with the vaccine. And the truth is this vaccine is going to take a while to be widely disseminated and have a real impact. Now, Governor Cuomo this summer started working on this, very early on to have a widespread distribution plan in the state of New York, one that's quite different from what the White House is proposing, where they're saying they're going to get it into the hands of doctors and to the pharmacies, which is great if you live in an area that has a lot of doctors and pharmacies. But large parts of New York City are what we call healthcare deserts. They don't have a Rite Aid or CVS or Walgreens. I mean, where are they supposed to get it? So we're focused in New York on making sure that communities that have been hardest hit, that make sure that they're not left out of the distribution of the vaccine early on as well, because many of those individuals in the black and brown communities, they're the frontline workers, they're the healthcare workers, they're the MTA workers. So we want to make sure that the plan includes everyone and is fairly distributed as quickly as possible.
Lieutenant Governor, just to finish on a final question about restrictions. We've seen restrictions from Massachusetts, we've seen it from Utah, and yesterday evening we saw it from the governor of New Jersey, Mr. Murphy. Now, Phil Murphy outlined a plan that we're all familiar with here in the UK, which is to close down indoor dining from 10 p.m. We're familiar with that because it didn't end there. Something else came next. Kathy, do you see merit in that approach? Lieutenant Governor, do you think that is a good approach to allow indoor dining to shut at 10 p.m.? Does that make sense to you?
To stop at 10 p.m., we actually have restaurants have to shut down at midnight in New York City, and that is part of our yellow zone. In fact, in upstate New York, those counties that you referenced earlier will now be having restaurants shut down at midnight because people tend to, the more you drink, the more you're out, more likely to gather at parties afterward. Just analyze human behavior. your defenses go down, the more alcohol you've consumed, the less likely you are to be compliant about wearing the mask. So we think it makes sense.
The issue that we have here, though, Lieutenant Governor, is it didn't stop there, and it clearly wasn't sufficient. You're not at all concerned that 12 doesn't make sense, 10 doesn't make sense, that actually you need to get ahead of what's about to happen through winter?
Well, you're asking if it's going to be more restrictive. Well, the numbers will dictate that in the state of New York. And New York City's infection rate was 1.8% on Friday. It has creeped up to about 2.5%. So clearly, yes, we are watching those numbers. And as we head into various zones, the one zone that does require a shutdown of restaurants is the red zone. What we're now doing is limiting the number of people at tables. You can't have 10 people at a table. You can only have 4. So everything you're talking about, we are watching what's going on in other states. But New York still maintains that we are the lowest large state infection rate. I think a couple of rural states are maybe a little bit lower than us. But we want to maintain that. And you're absolutely right that everything has to be on the table to consider if we get to that situation.